Hello, Dr.Day and I here from Steinway Family Dental Center. We get a lot of questions about dental insurance. Today we're going to answer some of the most common questions about that subject. So there you go. The first question is, do I need dental insurance? Well, not really. You don't really need the dental insurance to go to the dentist. A lot of dentists will accept just credit card or cash or checks or some other form of payment. It does not have to be dental insurance. However, if this is your cup of tea and you do have dental insurance and you would like to know how it works, there you go. So, number one, there's a difference in the type of dental insurance. It could be a PPO plan, which means it is a preferred provider insurance plan. This type of plans will pay per procedure to the dentist of your choice. Somebody who participates with the plan, they would get paid a certain agreed amount for a particular procedure. And you are not really assigned to any particular dentist with that. There are plans that are called HMO plans or DHMO plans, which is just a version of HMO plans. And those plans, usually you have a particular dentist that you are assigned to. Those are usually not favored by patients or by doctors. And the reason for that is because basically the doctor that you are assigned to, he will get a payment for you monthly, whether you go or you don't go. And of course, if you don't go, the monthly payment is so small that is insignificant and he cannot afford to do any treatment for you. So usually patients have difficulties find a provider that would actually see them in a timely manner. Usually those providers are booked for 3-4 months in advance, some more than that. It is because they simply cannot afford to treat you. So this is the HMO or DHMO plans. And you cannot go out of that particular dental office that you are assigned to, or you have no benefits at all. The next question is, do I have annual maximum? And the answer is yes, you do. There's a certain amount of money that each year that the insurance company will allocate it based on your policy. You have an agreement with the insurance company that they will provide payment for your dental needs up to a certain amount. Usually it is about from $1,000 to $2,500 and somewhere in between. Could be $2,000, could be $1,800, could be $2,500, but it's not going to be unlimited. There's always a limit of how much money insurance company will spend on your behalf. The next question is annual deductible. So each insurance like that will get you to spend the first $25, $50, or $100, and that is your annual deductible, meaning yearly deductible. After which your maximum for the year will be paid by the insurance company. But that's also not the entire thing, because most insurance companies make it more complicated than that. They will also nickel and dime it for each procedure. So for example, there are different types of procedures, and insurance company categorize them into preventative procedures, which would be your x-rays, your examination by the doctor, or even your prophylaxis cleaning, like just a maintenance cleaning, not deep at all. That would be your preventative procedures. Preventative procedures usually covered at 100%. Those are the least expensive procedures, and the insurance company, if you paid your deductible, will cover it for the most part. If it is a PPO plan, of course, HMO plans and so on, they wouldn't pay anything to the dentist, but under the contract, it's agreed that he would do those procedures for you. Preventative only. Now, the next procedures we're going to discuss are basic procedures. Basic procedures would be procedures like, let's say, fillings. And most insurance that would cover it on about 80-20, 80% insurance, 20% you would have co-payments for it, right? Again, that is still under the limit within whatever your annual limit is, and after you pay your deductible, and that is when you would pay 20% of the filling. Usually the way it works, insurance company give arbitrarily number to it. They will assign certain number to the procedure, and they would say, okay, we would give 80% of that number, and it varies from one insurance to another. How much the procedure cost, If the dentist participates with your insurance, then it is an agreed amount, right? So you would pay 20% of that agreed amount. If the dentist does not participate, then you would either pay the entire thing yourself and get reimbursed from insurance company, or there might be an agreement when the dentist will get 80% from the insurance and you would pay the rest, right? The next category is a major procedure, and usually major procedures are covered at 50% by PPO plans. So the insurance will cover half of the agreed amount with the dentist or half of the amount that is contracted under your contract. So if they'll say, for example, the procedure costs $100, they would give $50 for that procedure, right? The real cost of the procedure could be more than $100, but they will only give $50. And that means that you would have to be responsible for the rest of it. Another question is that those major procedures, do they have to be authorized by my insurance or pre-authorization required? The answer is not really, but the insurance company would want you to ask your dentist to pre-qualify for the procedure and so on. So basically, yes, they do want pre-authorization to be sent to them and so on, even though it's not really required, right? But they want you to do that just to waste more time so you don't get your procedures on time, and maybe you'll forget, because if you forget you don't get the procedure, then the insurance company doesn't have to spend the money. So the next question is, what if I need the procedure done over? For example, if you need a retreatment, let's say you had the root canal and it failed and now you need to do it over. So most insurance company will specify that either it is not covered procedure at all, or it would be covered under the clause that it would require pre-authorization and procedure the first time had to be done more than 5 years ago. Usually they speculate at 60 months. So 60 months divided by 12 months, it would be 5 years. But they do that because sometimes, let's say, it is a 5th year, but you still have for the full anniversary of the procedure another 3 months or so. So the procedure would not be covered until that 5 years and 1 day. So only after that you can request it, and then they would decide whether it would be covered or not. For the most part, they're not motivated to pay for the procedures, and this is what it's done for, right? Just kind of like hold it over, not covered procedures and so on. Also, a lot of procedures that are not really cosmetic, for example, implants are not always cosmetic because it's not in a cosmetic zone, so it's not in the front and it's not done for cosmetic purposes, right? Let's say it's a back tooth that is missing. They would still classify the entire genre of implants as cosmetic and would not cover that. Same thing goes with orthodontics, like if you need to get braces or Invisalign, those are not covered procedures with most insurances if you're over 18 years old or 19 years of age. Lastly, there is a big chunk of insurance companies that we have not discussed, and that is Medicaid and Medicaid type insurances. We call them government subsidized insurances. For the most part, they're not paid by the member, they're paid by the government and just given to the member. And lately there are some changes when you can actually purchase those insurances. So there are some exceptions. You might be having an income and you want to buy this government insurance, right? You can do so. You should be aware that government insurance have strict rules and regulations, and the doctor that sees you have to abide by those rules. So if the procedure is not covered, you may not get it done. Not under that plan, not even at the same dentist, because he's simply not allowed to do the procedure. So what is it that your plan says, right? Because each plan is a little bit different. If you have more questions about your particular plan, we do check insurances, and we would do that absolutely free of course. So you can call us with your insurance and we will find out what kind of plan it is and let you know what to do. It is time now that when all the insurances it's a new rolling in, so you can change your insurance plan. But I would suggest before you actually purchase the insurance plan or pay anything for that, you would find out everything about the insurance and then call us and let us know what insurance you're looking into and what are the reasons that you're looking into that particular plan, and we would tell you the truth whether that plan will help in your particular case or it would not be the best choice for you. So give us a call and we'll be glad to help you. The telephone number here is 718-728-3314, or you can find us online on alldentalneeds.com. Request an appointment and come in, bring your insurance information, and we'll discuss it with you.